I'm Colonel Stephen Hernandez. I'm an Air Force reservist serving in New York City at Lincoln Medical Center. I am an associate professor with tenure at the University of New Mexico College of Nursing. I'm also, as a reservist, the reservist assigned to the Dean of the U.S. Air Force School of Aerospace Medicine that's at Wright-Patterson Air Force Base, Ohio. And I've been a reservist for 23 years now, and I've been a registered nurse for 25. I do think that there's a correlation between nursing and serving in the military. Nurses serve their patients, their communities by taking care of people. The military, like the mission that I'm supporting right now, we're helping serve our country and people in need. So whether it's in our own country or in another country, there's helping other individuals. I had returned from a deployment in 2004 and found out that I had access to GI Bill benefits as a result of that deployment. And I had a master's degree and I was teaching at a university in Louisiana. And I really wanted to advance my education. So I found that University of New Mexico College of Nursing had a PhD that was distance learning by doing online coursework and also doing some additional coursework in person. So I completed the PhD in 2012, had a wonderful experience and enjoyed working with the faculty at the College of Nursing at UNM. And an opportunity opened up for a tenure track faculty member sometime in early 2013. And I applied for that position. And the dean at the time, Dean Ridenour, thankfully hired me. And I joined the faculty in July of 2013. We've been in Albuquerque for 7 years now. Our oldest son's in college and youngest son's at high school, finishing his freshman year. And we've had an unbelievably great time living in Albuquerque. Leading up to being deployed to New York City, I was really wanting to help out the community because I have a background in medical, surgical, and critical care nursing. And about the same time where I was approved to volunteer, President Trump had signed an executive order authorizing the deployment of reserve component forces to provide support for the COVID-19 response throughout the country. I packed my bags and booked a flight, and I was here at New Jersey on April 5th. By the next day, they had stated that we were going to be supporting the New York City hospitals for my particular group. And I believe we were in the New York City hospitals the very next day after we got to New York City. So initially, you could definitely see that there was a crisis with this epidemic. I think that everybody knows that COVID-19 hit New York City especially hard. I have been doing direct patient care, but my primary focus is making sure that the people that I was sent with on that team had everything that they needed to do their job. So when I wasn't taking care of the team, when I was in the hospital, then I was absolutely helping out with, different things with patient care. But I would describe my role mostly as just making sure that everything that was needed for the team was available. Initially, I think that there were around 120 of us in the Air Force group, and that eventually got up to 250 people. This is really a dream deployment for myself and the other service members that are here. We all sign up to serve our country. to support our country in a time of need. Normally, we do that outside of our country, and for us, this was a dream because we could actually stand up and support our fellow citizens in a time of need and crisis. So, for me, this is a deployment of a lifetime, something that we haven't seen in the modern time, and I'm very proud to have been part of this, and I think that we all are.